you saw us draw a little line here, and then we saw a little dot here, and a little line there, and then we came down here like this, and then we did another line back here. So all those lines basically relate to where we want to get a little bit of a lift. So we pull back on these vectors, and we pull back, and you see how it's pulled up our nasolabial fold, and you see how it's on the marionette, but I kind of pull around and see if there's another little area that I can get a little bit better lift. So it's not just drawing lines, it's seeing where you need to put the thread to give the most lift, okay? And then you think about the anatomy, and is this an area that I can really start a thread and go? So let's kind of look on this side. So we typically go about 1 centimeter behind the lateral canthus to put our first dot. And the reason we do that is there's a nerve right here, the temporal branch of the facial nerve that's further back, so we try not to stay further back. A little more forward of that, we know that there's a little notch like right here. And what comes up through that little notch?
Facial artery.
Yeah, facial artery and vein and the nerve. And back here is our master. We all know where the masters are. And another landmark that we want to keep in mind is our zygomaticus major. I like orange. Orange is cool. All right, so up right through here is this little vein that comes up. That's our facial vein. And right around in this spot here is our parotid. And right about there is probably where you're going to find the facial vein. But the facial artery. The facial vein comes in between the parotid and comes up under the zygomaticus minor, and then it kind of loops around and comes like right about here. So if you've done tear troughs and get bruising, that's the facial vein that we have to worry about. The ligament. And when you have these zygomatical facial ligament, and when you have ligaments that are retaining ligaments, that's what causes that nasojugal groove, the tear trough. That's where vessels come up, and that's where nerves are. So it's going to be a little sensitive here. So this is an area sometimes where you'll go in, a patient starts to feel it a little bit, so maybe you have to give them a little lidocaine through the cannula, but it's going to be a little tougher, and you have to kind of push through it, or kind of twist through, or pull up. And you'll see that with Danielle. She'll do some twisting, she'll push a little bit, but she's mostly pulling the skin over the cannula, okay? So she's pulling it over. So as you come down here a little further, you're going to find down in this area here, there's another ligament, the mandibular ligament. And when your threads come down this way, you know, the masseter, there's a masseteric ligament back here. And we have another thread that would go back there. There's a parotid ligament back in here. So these are all areas of these ligaments that are going to be a little tougher to get through, and they're going to be a little more sensitive. So you may have to think moving the hub up and down and watching where the needle is. Those are all little sweet little things to watch. All right, any questions?
The technique for placing the lifting threads is what you described. The technique for placing smooth threads is the same technique or a little different? You don't have to worry about
so
the
much
threading.
easier. I mean,
Just pass it through.
Yeah, you pretty much, and you'll see that.
Yeah, those just glide right in.
Yeah.
They're
Still,
fun.
the bending is still the same.
Yeah, this bending.
If you need to correct your orientation, the bend of the hub is still the same, but
Yeah, and
much easier.
hopefully we'll do somebody's vermilion border the lips. That's the sweetest thing. You know, before when you try to do vermilion borders, you're trying to keep it really thin and stay within that border. This is just like boom, and it really makes the lips pop.
They're already looking around the room saying, yeah, right?
Yeah.
This is all going to be really good.
Good, so, okay.